The Sikkim State AIDS Control Society was set up in 2001. Before that, we had the AIDS Cell. Now, the Sikkim State AIDS Control Society was set up to carry out the National AIDS Control Program, which is in the final stages of the third phase, or NACP3 as it is known. Now, the object of NACP3 is to halt and reverse the HIV epidemic. Now, there are 4 components to NACP3. The first being the prevention of HIV infection, new cases of HIV infection. And for this we have various strategies, targeted intervention program against high-risk groups, that is injecting drug users, commercial sex workers and men having sex with men. Secondly, we have integrated counseling and testing centers both for the general public and for pregnant women. Now the latter is also known as PPTCT, or prevention of parent to child transmission. Third is the prevention of sexually transmitted infections, especially in the high risk groups. For this we have STI clinics and we also promote condom promotion. Then we have the supply of safe and adequate quantities of blood in the blood banks or in the blood storage units. And lastly, we have information, education and communication, or IEC. Now these are the components for prevention of new infections. The second component of NACP3 is care, support and treatment for people living with HIV/AIDS. In this component we have the antiretroviral therapy centers, or ART centers, where people receive free treatment. And then there is a community care center at development area for HIV patients. They are treated out there, kept for a few days and then allowed to go home. And thirdly, we have drop-in centers for injecting drug users, for commercial sex workers and for people living with HIV/AIDS. The last, that is the one DIC for people living with HIV/AIDS, is run by the Sikkim Network of Positive People and is situated in the STNM complex also. Now the third component is strengthening of infrastructure and capacity building. Now in Gangtok, in Sikkim rather, for this we have the State Research Laboratory situated in the STNM hospital, which caters to patients who are suffering from STIs or sexually transmitted infections and even HIV. Now the fourth component is strategic information management. Here we provide computers to all the reporting units, and there is a common reporting format throughout the country where information is shared and compared. We utilize the services of TI NGOs. Certain NGOs are contracted to provide these services, and we fund these organizations. So with the help of these organizations, we have been able to successfully carry out the National AIDS Control Program till now.
And RSC means Red Ribbon Club, and it is to create awareness among the people who are suffering from HIV/AIDS. And every Saturday we talk about how to create awareness in our school and in outside also. We go to certain places and we create awareness and we tell them how HIV is caused, what is the result of the HIV/AIDS. So we create awareness among the people who are suffering from HIV positive.